Corneoplastique, a super specialty that I conceived nearly 3 decades ago. And how I came about this concept is while I was teaching all over the world, and even surgeons who were visiting me from all over were constantly displaying to me their inability to understand how I was planning these techniques, and then their inability to grasp the results, even though they were looking at my patients. And my patients were talking to them and explaining everything. And I realized way back that there was a barrier for all of these very able and intelligent surgeons, that they were not only not able to cross over those barriers. For example, a LASIK surgeon couldn't comprehend how to do a premium cataract surgery, or a cataract surgeon couldn't comprehend how to do LASIK techniques, or they would not know the difference between how to optically arrange each optic and yet make it work together. This barrier, I found, was not just surgical. These were very capable surgeons, but their inability was more from a mental barrier, which had kind of arrested their innovation, their thought process. That's when I wanted to design a concept and super specialty that would not only free up my colleagues, the eye surgeons, but result and actually perform for their patients, free their patients up, as I call it, vision freedom. That's where corneoplastique comes in. It's not just one surgery, it's a conceptual thought process, a super specialty, if you may, of 40 different techniques and technologies. I'm not saying I want a refractive surgeon to do glaucoma surgery or plastic surgery or a retinal surgery. No, but every optical surgery, every surgery that affects vision should be called vision corrective surgery. And I want that surgeon to know all the techniques, technologies, and concepts of vision corrective techniques. So you can't just call yourself a LASIK surgeon or a corneal surgeon or a cataract surgeon and call yourself excellent or advanced because now you're doing a SMILE or something else, or you're doing premium cataract surgery. No. It is absolutely mandatory. It is absolutely understood that you should understand and know all these optics. There's nothing new about it. It's being done for over 100 years. So when I put all these things together with the backbone of what I call my mental sorter or the Golani 5S system, there is practically no patient whose glasses and contact lenses I cannot remove. As long as those patients are over 19 years of age, are stable, all that, of course, is important. But beyond that stability, there is literally nobody whose glasses and contact lenses we should not be able to correct. So corneoplastique then gives you that freedom to move forward, meaning you can move between corneal techniques like my lamellar surgeries from anterior cornea to posterior cornea, intraocular techniques like phakic implants, pseudophakic piggyback techniques, laser vision techniques on the cornea with implants in the cornea like intact rings or whatever you need to manipulate the cornea, LASIK techniques, laser plastique techniques that I do a lot, which are the non-cutting, no flap techniques, and even combinations. You can combine, you can manipulate the optics, you can go in the eye, I call it inside out technique, plan a technique like literally induce a measurable refractive error, then come with a laser, correct that, or outside in technique. Stabilize an irregular cornea and do a premium cataract surgery inside. Add a piggyback lens to one of your colleagues' surgery if it didn't work. So you're moving forward in a fluid system. It also empowers you to move backwards and sideways. Many patients who come to me from all over the world, over 70% of my practice, which is fixing complications, you can actually think across. Let's say they've had 9 surgeries. I did a patient a month ago who had 18 procedures. Doesn't matter. You look at the anatomy, you look at the optics, and you decipher in your mind, sort it out with the Golani 5S system. Corneoplastique is your way of how to address it. So even if they had all these surgeries, what is the situation now? So I had to remove the ICL, I had to correct the corneal scar, I had to remove the cataract, rearrange the intact ring, but in 2 stages. Brought this patient straight to 2020. So it's very, very, very important to understand that corneoplastique is my way of not only sharing my work of over 3 decades, but also to guide the industry, also to empower, inspire my colleagues to understand that they don't need to be restricted mechanically or surgically, as well as mentally. Be completely free, be fluid in going forward, backwards, sideways. Take each and every patient with 100% consistency to excellent vision. And then you will see the outcomes of these patients, which I want you to be addicted to. I have done something very difficult for me, which is I put all my patients on camera. Remember, these are some of the world's most intelligent, skeptical, demanding patients who come to me. And yet, you've seen their reactions on my social media where they're exuberant and all these very important and intelligent patients are sharing their happiness. I want that to be a source of inspiration. And that's the only reason I'm doing it, to share with my colleagues that this is the future. The recent recognition from the US Trademark and Patent Office only underscores what I've been teaching and sharing for the last 3 decades. It is a privilege to be an eye surgeon. May I encourage all of you to rise to artistry. Dr. Kalani.